Hello friends. Today we are going to discuss about long-acting injectable aripiprazole. I am Dr. Suresh Badanmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about the long-acting injectable aripiprazole, what are the indication, how to start, and what does the research say about long-acting injectable aripiprazole. Aripiprazole is a atypical antipsychotics, usually considered as second generation antipsychotics, but however, the researchers say that it is a third generation also. It is widely used in treatment of various psychiatric disorders such as schizophrenia and bipolar disorder. The introduction of long-acting injectable aripiprazole formulation has gained prominence in chronic psychotic condition. Especially, it has been found to be helpful in chronic schizophrenia and multiple relapse patients with bipolar disorder. Aripiprazole acts as the one and only D2 partial agonist and antagonist also. When the extracellular concentration of dopamine is very high, it will act as a D2 blocker or antagonism. If the extracellular dopamine level is very low, it acts as a agonist. So, it is considered as a dopamine stabilizer at this point of time. Hence, it is also called as a third generation antipsychotic. It also has partial agonist activity at 5-HT 1-year receptor and antagonistic activity at 5-HT 2-year receptor. This unique pharmacological profile and receptor profile produces less side effect with regard to weight gain, sedation, EPS when compared to other classical antipsychotics. Now let's discuss about how this aripiprazole is prepared as a long-acting injectables. Let's understand about haloperidol deconate. Here, solid drug particle of haloperidol is mixed with an oil and it is dissolved in the oil to form a clear oil-based solution. And now, this oil-based solution is injected deep intramuscular. This is common in haloperidol deconate, flufenazine deconate, or any other deconate, especially first generation antipsychotics. The second technology which is very well known is risperidone microsphere. Here, the drug particles are trapped in a polymer, and these polymers are in a microsphere, and these microspheres are suspended in a liquid solution. And when it has to be reconstituted, it has to be shaken before injection has to be given. Here, it is a risperidone microsphere. Here, in this microsphere, the drug particle, which is an active drug, diffuses out of this polymer and gets into the circulation. So this is how the risperidone microsphere works. But now the aripiprazole has one more important way of giving and formation. Here the solid particle of aripiprazole is mixed with a liquid, and invariably this does not dissolve in the solution, and hence it forms a cloud and opaque solution. Invariably it is kept for longer duration, it settles down. However, here the aripiprazole particle will be not densely packed, and invariably it is formed as a loosely suspended particle. Hence, it will be easy to reconstitute. That is how aripiprazole Lauroxil is done. However, there is a nanotechnology also has been introduced in aripiprazole. Let's understand how the aripiprazole are available. Aripiprazole are available in two formats. One is aripiprazole monohydrate, which is given once a month injection. Aripiprazole Lauroxil, which is given as a either 6 weeks or 8 weeks injection. Of course, monthly injection also can be given. Now let's discuss about Aripiprazole Monohydrate, which is a monthly injection. Aripiprazole Monohydrate, about it takes 14 days to reach the plasma concentration level, that is peak. To overcome this issue, the healthcare provider needs to administer either a loading dosage or concomitant oral aripiprazole. So hence, there are two methods of giving aripiprazole monohydrate. One is giving concomitant oral aripiprazole along with the parental dosage, or else give parental dosage as a high dose. Please understand, whenever you give injection, it takes 2 weeks for the peak concentration level. Now let's discuss about concomitant oral and parenteral dosage. Here, the aripiprazole monohydrate is available as 400 mg and 300 mg vial. Here, the first you have to give aripiprazole 300 mg IM, and followed you will be giving concomitant aripiprazole medication either 10 mg or 20 mg per day. Before you start this medication, you may have to give aripiprazole to know whether the patient is able to tolerate aripiprazole, that is tolerance. If the patient is able to tolerate this medication, you can give IM aripiprazole monohydrate 300 mg along with the medication which is given for next 2 weeks. The second one is loading dosage. Here, two separate doses of 300 mg or 400 mg given in two separate places, either on either side of the deltoid or either side of the gluteal muscles, or else right deltoid, right gluteal, or left deltoid, or left gluteal. That means you can give these two injection in two different sites along with the single dosage of 20 mg of oral aripiprazole. Further, the maintenance dose of aripiprazole will be given after 26 days as a single dosage. Invariably, don't give before 26 days. A dosage increase or decreasing can be based upon the patient's response. If the patient does not tolerate, you can decrease from 400 to 300 mg, and if the patient does require, is not responding adequately, you can give 400 mg per month. Now let's discuss about Aripiprazole Lauroxil. Here, this is a prodrug. That means it is not an active ingredient. It has to be metabolized and absorbed into the circulation to become active drug. Here, there are two different formats. Crystal particles of dodeconic acid, methyl ester, and the second one, as I mentioned, nanocrystal technology for an extended release formulation. Let's discuss about crystal particle of dodeconic acid methyl ester. Aripiprazole is supplied in a loose association of drug particles to minimize the sedimentation. When you are about to give this injection to the patient, you need to tap this pre-filled syringe 10 times and shake this syringe vigorously for 30 seconds. Once you have done this, you should give this injection in next 15 minutes. If you do not give in next 15 minutes, you have to redo the process, tapping 10 times and shaking vigorously for 30 seconds. And when you are giving injection, you have to give it in the deep intramuscular injection in a rapid continuous manner, not in a slow fashion. If you give in a slow fashion, there is high possibility aripiprazole sediments can clog the needle. Let's understand by this diagram. Here you have a pre-filled aripiprazole syringe. You need to tap this 10 times and shake it vigorously for 30 seconds before you inject aripiprazole into the patient. Now, once you have prepared it, you need to give this injection within next 15 minutes. When you are about to give, you need to pierce the skin into the deep intramuscular, and you have to give it in a rapid, continuous manner. Make sure the needle is not in the IV. You need to give in a rapid and a continuous manner so that the clogging does not occur. Now let's understand how aripiprazole is available in the market. It is available in the 4 different dosages. One is 441 mg and 662 mg given monthly, 882 mg given every 6 weeks, 1064 mg given 2 months once. So these are the dosage available in the market. So let's understand how it is given. Aripiprazole Lauroxil, which is given as a maintenance treatment in a monthly, you need to understand the conversion. Invariably, aripiprazole has to be given only when the patient is stable on aripiprazole. If he is on oral dosage of 10 mg, you need to give 441 mg every month. If he is on 15 mg, give 662 mg every month. If he is taking oral medication 20 mg, either you can choose 882 mg every 6 months or 1064 mg every 2 months once. Now let's look into the Aripiprazole Lauroxil nanocrystal technology for an extended release formulation. Here, the nanocrystal technology for an extended release is available as a 675 mg. Here, it is invariably given for initiation of the treatment or to restart of the aripiprazole medication if the patient has stopped. This is given to provide a therapeutic blood level within 4 days of injection. Here it is a nanoparticle. It diffuses very fastly. Within 4 days, it achieves the maximum concentration in the blood. Hence, you need to give this injection only when you are initiating, or else if the patient has missed the dosage, at that time you will be choosing Aripiprazole Lauroxil 675 mg nanoparticle technology. However, you need to give concomitant aripiprazole 30 mg as a loading, or else concomitant oral aripiprazole 10 mg for 21 days. Either one of them you can choose. Let's discuss how aripiprazole is given. Aripiprazole monohydrate, which is available as an aqueous suspension of crystal particle, which is given either as a 300 mg or 400 mg monthly in a gluteal or the deltoid muscle. Here you need to give oral concomitant aripiprazole medication 10 to 15 mg for next 2 weeks. The next one is Aripiprazole Lauroxil, which is given either 441 mg or 662 mg monthly, either deltoid or gluteal, but you need to give concomitant oral medication for next 3 weeks. The 6 weeks injection is 882 mg Aripiprazole Lauroxil along with oral medication. And the final one is 1064 mg, which is given 2 months once. The another nanoparticle technology based Aripiprazole Lauroxil 675 mg is given only during the initiation of aripiprazole injection or whenever the patient has missed the dosage, then you are giving this injection. It is given as a single dosage. The reason being this nanoparticle technology increases the serum peak level within 4 days, and you need to also give oral aripiprazole 30 mg in the loading dosage. Please remember, this is given only for initiation of aripiprazole long-acting injectable. Now let's discuss what does the research study discusses about aripiprazole long-acting injections. With regard to mood disorders, there is an important article, a systematic review done by Pacioretty and his colleagues. This article is published in European Neuropsychopharmacology in 2019. In this, the authors did a systematic review. In that, they included 15 studies. 6 were double-blind and 9 were open-label studies, in which 13 looked into bipolar affective disorder and only 2 into schizoaffective disorder. The authors concluded diponeuroleptics prevented manic episode, but not prevented the depressive episode, and few of them may worsen depressive episode. Risperidone long-acting injectable was effective in protecting mood and manic symptoms compared to placebo, but did not prevent depressive recurrence. Add-on or monotherapy of paliperidone palmitate was helpful in schizoaffective disorder in preventing manic symptoms and also depressive symptoms. Whereas aripiprazole monohydrate significantly delayed the time to recurrence of manic episode without inducing depressive episode. Hence, this study concluded long-acting injectables were very safe in bipolar and schizoaffective disorder. Now, with regard to long-acting aripiprazole in schizophrenia and bipolar disorder, what does it say? Rapsinski and his colleagues published an article in 2019 in a journal called as Clinical Drug Investment. In this, the title of the study was Long-Acting Injectable Aripiprazole Formulation in Treatment of Schizophrenia and Bipolar Disorder, a systematic review. This systematic review aimed to investigate and compare the effect of two formulations, that is, aripiprazole monohydrate and Lauroxil of the aripiprazole in patients with schizophrenia and bipolar. They looked into whether they were able to prevent the relapse, especially during an acute episode, whether they are able to bring down the symptoms, and also during maintenance treatment, whether they prevented relapse. They wanted to know in terms of efficacy, functioning, safety, and recurrence or rehospitalization. They included 28 studies. In that, only 3 of them were not sponsored by pharma company. Remaining 25 studies were sponsored by pharma company. Although it is sponsored by pharma company, you need to be careful with regard to understanding and also taking this results with a pinch of salt. Although these studies were rigorously conducted, 54% of them, authors of these studies, had received funds from the pharma companies. Aripiprazole, long-acting, may be efficacious in reducing relapse of schizophrenia and bipolar in the long-term stabilized patients. This was the conclusion of the authors. However, aripiprazole monohydrate and aripiprazole Lauroxil play a crucial role in improving the symptoms of schizophrenia during its acute phase. So that means both Lauroxil and monohydrate were found to be helpful both in acute phase of schizophrenia, bipolar disorder, and also in maintenance phase. What about use of aripiprazole in children and adolescent population? In this regard, there has been an important publication, Beza and his colleagues, in Pediatric Drugs Journal in 2023. The title of the study was What Role for Long-Acting Injectable Antipsychotics in Managing Schizophrenia Spectrum Disorders in Children and Adolescent, a systematic review. The authors did the review and looked into the research. There was hardly 10 studies were available, and that too in adolescent population. The preliminary evidence suggested, yes, it can be used. Whereas aripiprazole was given only in 10 patients, and it has found to be safe in these 10 patients. However, there are no studies which looked into aripiprazole injection given to a child who is less than 12 years. Hence, there is no data available sufficiently to make any impression with regard to adolescent population, and there is no data at all with regard to children below the age of 12 years. To conclude, aripiprazole is an effective treatment both in schizophrenia and bipolar. So, the long-acting aripiprazole is also effective. That's what the current available research say about it. Long-acting injectable aripiprazole, the preliminary evidence suggests that yes, it is useful in acute episode and also in the maintenance of schizophrenia and bipolar disorder. This long-acting injectable aripiprazole can be a game changer in the long run. Preliminary evidence is supportive towards use of long-acting injectable. However, this availability, accessibility, affordability will be the main bottleneck in use of aripiprazole in countries like India. Although long-acting injectable aripiprazole is not yet introduced in India, I am hoping it will be introduced shortly, and this can be a game changer. And hope the cost of this injection will be kept low so that the patients who are chronically ill, who are devastated, can afford this injection, and that can bring change in their life. Thank you very much for giving your valuable time. Stay safe.